A typical day of work for me, it involves getting everybody's medications on board, making sure I'm checking in with all of the clients and seeing how they're doing, and basically being available. So as moments throughout the day that can be hard come up, I'm available and can help with them managing those.
The medical team, I consider them the front lines with clients. They're the ones that are here 24/7. They see the good, the bad, and the ugly with each and every patient. And so they need to be able to get to the patient's level, to talk to the patient. They need to be able to de-escalate when the patient's ready to walk out the door.
I evaluate how the patients are feeling on their medications. When I'm on call, I'm available day and night to answer questions for the nurses in case a patient's not doing well and needs other medications to help them feel comfortable. Then I'm always available to call in. When I'm on site, I evaluate people in real time. So if I start something and they're not feeling well in an hour, they can come back to me and we can change up what they're on to make them feel better.
One of the best reasons for being a nurse at Sandstone is helping these kids so early on when they're coming in and may not have had anyone to support them before. They might not have had anyone to respect them or listen. Being able to help them maybe change the course of their life is an incredible feeling.
What makes me the most excited to go to work every day is just, again, being able to have the opportunity to support, especially up at Cascade, these kids in a way that you really don't get to other places. Being able to have the freedom to really focus on that connection and give that emotional support is really nice, and I think it helps the kids a lot.
It's amazing to work as a nurse practitioner because I have the autonomy that I would want, but I also have really experienced physicians that are really accessible and are always happy to answer questions.
So a good nurse that would fit in with Sandstone. Someone that's very calm. You don't react when someone else is coming at you. You can empathize with your clients. You can't empathize, you can sympathize still. Understanding that these people they're not having their best days.
Some of the things that make such a great nurse to work for Sandstone, you have to have compassion, but you are someone who understands that they might be upset and you don't take that personally. That's what I look for when I'm looking for a nurse to come work with us.
Nurses that this might not be the right fit for them might be someone that is very rigid. I think you need a lot of flexibility in this position. Stuff is going to come up throughout the day, and you're going to have to be able to adjust quickly. If having to have a specific routine and stick to it and not deviate from that and not being able to think on your feet is definitely going to make it hard to succeed in this position.
As a supervisor, as an executive member of the team, I also see when people don't have that passion and that drive, and they don't last long. They either decide this isn't for them, which is okay, or maybe go somewhere else into a field that's more comfortable for them. Because mental health, this field is hard.
Every day, I kind of see how Sandstone's a different place to work than most places. Particularly our BHTs working up at Cascade and being with the teenagers are so emotionally connected to them, and that just makes all the difference for them.
So I wouldn't say there's one specific awning moment where I was like, I know I'm in the right place. But I think every day when you see those breakthrough moments, even when they're tiny, when you see a teenager that hasn't smiled or laughed in the whole time they're there, and you finally see one breakthrough, that's when it hits me. I'm like, okay, we're doing something here. I know I'm in the right place.
I've worked for places where the nurses and the nursing department don't mean anything. We are important at Sandstone. We are part of the team, and being able to bring nursing ideas and what can benefit our clients and what can benefit our team. And we are heard when we're talking to executive leadership.
I feel like I knew I was in the right place when I went through a life-changing event, divorce, moving across the country, kids, and all of my team, all of my leadership were supportive.
I knew I was working in the right place when I got to Colorado, and I was immediately greeted by the staff. Every staff member knows every patient by name, knows every patient's preferences, even things as far as, well, he's feeling uncomfortable right now, so he needs a couple minutes alone, but in probably 5 minutes we should go in and talk to him. And I think that's just so interesting that every staff member takes the time to know their patient. And that's what I've always wanted out of medicine, and now I get to do that. So I know I'm in the right spot.